And welcome to a special edition of the Tadpole. We're going to pass along some information to you here concerning the events that are going on around the world right now with the virus. And we have with us Dr. Doak Doolittle, MD, the Phillips County Health Systems, also Jamie Baker, Infectious Prevention Coordinator. And thank you for joining us today. Doctor, first, let's see, at what point would a patient present at the clinic or ER to be seen for suspected coronavirus?
The symptoms that we're concerned about right now are respiratory, and that would be a fever, a cough, coughing, sneezing, expectorants, pulmonary symptoms also. Unlike the influenza, which is more high fevers and muscle aches, although they can have some respiratory. But this is distinctly respiratory for the coronavirus, or as we want to call it now, COVID-19.
It's easier for me to remember coronavirus than COVID-19. Anyway, okay, doctor, then so what are you saying that people should call before they show up with symptoms similar to that of coronavirus?
Yes, we want all people to call with symptoms. They may or may not be seen with the way this is evolving in this area. It depends on our resources and the severity of symptoms. But we don't want anyone to ignore any symptoms, and we are going to follow the Kansas Health guidelines and also the CDC guidelines. Not everyone with symptoms will be tested. Will be determined by the Kansas Health Department, and we must call them to see if, after the patient is seen, if indeed they're sick enough to be seen. The keys are exposure, if it's known, to the COVID-19, or exposure, respiratory symptoms, or respiratory symptoms without known exposure or travel.
Okay, then, so how do you test for coronavirus?
We test it, it'll be a nasal swab, very similar to influenza. We may also be doing an oral swab, and ideally, if they have productive cough, to check some sputum or phlegm that is coughed out of the lungs.
Okay. Okay, then, so what is the Phillips County Health System doing to prevent the problem?
Well, we had a meeting scheduled community-wide this morning, which we had. It's a little more urgent because it is now in our area in southern Nebraska. So we are on the alert. We had, at our meeting this morning, we had EMS, we had nursing administration, we had infection control, Jamie, we had hospital administrator, we had the long-term care facilities, we had Phillips County Health Department, we had EMS, and I believe that covers.
Okay, so,
yeah.
So a complete cross-section of everything.
Exactly. We put somewhat of a game plan into place following national and state guidelines.
Okay, very good. Okay, so Jamie, can you walk us through the screening process and what happens if the patient is suspected of having the coronavirus? What happens?
Sure. Okay, so we have developed a travel screening, a COVID-19 travel screening that will be done on every single patient very first thing as soon as they walk in the door. These ask simple questions such as, have you traveled to the Hubei province of China in the last 14 days? You know, have you traveled to Iran, Japan, South Korea in the last 14 days? Or if you've traveled to one of the U.S. territories affected by the COVID-19 virus right now.
And we better add Italy.
Oh, that's on here. I just forgot to say it. I'm sorry. Yeah, it's on here.
Right. Get the information out.
Yeah, and so, or you know, and then the next question down would be, you know, have you been in close contact with a person that has confirmed COVID-19 in the last 14 days as well? We would ask if they've had a fever, shortness of air, cough, just the very general symptoms that, you know, present with the COVID-19 virus. If any of these questions are yes, the patient will be immediately placed in a surgical mask to contain their secretions. They will be placed in an isolation room with a door closed with limited entry to only mandatory personnel. we would then, we would obviously implement our airborne precautions, our standard precautions, our contact precautions using eye protection. And then they would, at that point, follow this algorithm from, the KDHE, which is the Kansas Department of Health.
Okay. You can tell we're at the hospital. We have emergencies coming up here. Okay, go ahead.
Heidi.
So if a provider then suspects the COVID-19, sorry, if the provider suspects a COVID-19
Sure.
person under investigation, they would notify me as the infection prevention nurse, and we would, like I said, implement the correct precautions.
Sure.
And then we would also test for like an influenza and a respiratory virus panel, just to kind of rule out, maybe this is the
Sure.
reason for their symptoms. At this point, we would then call the KDHE 24-hour hotline that they have, which is the Kansas Department of Health. They have to give approval for us to even test. They have the kits. We do not have the kits. They will send us the kits.
Wow.
If they decide that the patient meets the criteria and needs to be tested for the coronavirus, they will send us a kit. Until that point, we will be, holding that patient and, treating them
In
as if they
quarantine,
do
right.
have,
Sure.
treating them as if they do potentially have it.
Have it until they determine. Okay.
If the KDHE says no, they don't need the testing, we would then treat them for their respiratory illness and send them on their way or be admitted, whichever
Sure.
it indicates. After we get the kit, let's see here. The KDHE will provide specific instructions for testing and for this process. Once we receive the kit, we will collect and send any necessary specimens, like Dr. Doolittle was talking about. If they're positive and they can go home, we would have to notify KDHE that they're stable to go home, and then they would, monitor all of that. If they have to be hospitalized, then they would be transferred, which at this point they'd probably already be in our isolation,
Sure,
our
right.
negative air pressure isolation room, but they would stay there and, receive treatment until they're stable to go home.
Treatment will continue. Okay. So that's a process that's already been, and as you, hopefully it doesn't occur, but someone out there looking right now, watching, what should they do to maybe prevent anything, possibly prevent that? I mean, some quick,
Oh, sure.
I know we're supposed to wash a lot your hands and,
Sure,
and
yeah.
don't touch your face and that type of thing. Yeah.
Yes, so the best thing that we can say to prevent the spread of this virus is to wash your hands all the time.
Yeah.
Cover your cough. Avoid places if you are sick. If you're going to the grocery store, wipe the cart handles off. These are things that we should be doing anyway, especially in the midst of this influenza season. And so these are just very important things to know anyway, but this is kind of how we would prevent the spread of this COVID-19.
And I think the main reason why we're doing this tadpole is that things are in place here at the Phillips County Health System.
Absolutely.
So,
yes, and we're doing our best to collaborate with our community resources here and all of our healthcare team here in the community, and so we will be meeting with them. I believe we're going to be meeting with them every week. Just to kind of give a rundown on what's going on in the community, what can we improve, what can,
But you are prepared.
Yes,
Okay,
yes,
well,
we are.
and that's the good news, just-
Yeah, so.
Okay, very good. Well, I don't think we'll have Dr. Doolittle back. He's doing what he does here at the hospital. As you could know, we are at the Phillips County Health System right now doing this, and we appreciate you coming on too, and Dr. Doolittle for coming and joining us. I guess that's going to do it. Special report. You might pass this along to your friends if they're watching. Tell them you can watch it on My Phillips County Online and just see what's being done here in the Phillips County Health System. Good job. Thank you.